Hi, let's talk about the ureters, urinary bladder, and urethra. In this video, we'll discuss the structures and processes involved in the movement and storage of urine, particularly in the ureters, the urinary bladder, and the urethra. We'll also discuss the autonomic innervation and blood flow to the urinary bladder, as well as the differences in the features between male and female urinary bladders and urethrae. So let's begin our story with the ureters. The ureters are continuations of the pelvis of the kidney, or the renal pelvis, and there are three parts to them. There's the abdominal part, which begins at their origin and runs down to approximately the pelvic brim. Then there's the pelvic part, which continues on to the posterior aspect of the urinary bladder. And then there is the intramural part. And the intramural part is the portion of the ureter that is within the wall of the urinary bladder. Now, where the ureters cross into the pelvis, so where they transition from the abdominal parts to the pelvic parts, are just at the bifurcation of the external iliac artery from the internal iliac artery. So you can look for the ureters in that approximate location. Now here we can see a hemisected pelvis. So this is anterior, and that is posterior. And we can see the right common iliac artery descending down, and we can see it, well, we can't really see it, but we can see its two pathways. That's the external iliac, bound for the lower limb, and this little tortuous individual is the internal iliac artery. And we can see that it has both posterior and anterior divisions. But most importantly, we can see here is that ureter crossing over from its abdominal part to its pelvic part. And so we can see that moving through the pelvis there. Now, it's very important to understand that sex isn't binary, that, looking at the full scope of anatomical and physiological variation throughout organisms, especially humans, we can see a wide range of continuous variation. And whereas society may throw individuals rather unjustly into, buckets of male or female, we can see variations of and elaborations of all types of sex and of neither type of sex. So what we conceive to be male and female are really kind of extreme forms of modes on the distribution of things. Now, that being said, with respect to the internal iliac artery, we've seen before how variable vasculature can be, and the pelvic vasculature is no exception. It's rather confusing, but it's important to know that vessels are all named for their targets. So as long as you follow the vessel to its target, you can usually have some sense of what it is you're looking at. Now, with respect to the blood supply to the urinary bladder, there are going to be superior vesical arteries and inferior vesical arteries. The superior vesical arteries are probably the most straightforward examples of branches of, a branch of the internal iliac artery as we can get. So the anterior division of the internal iliac artery gives off this lovely and robust medial umbilical ligament or artery. It turns into the ligament on the anterior abdominal wall where it becomes obliterated. Typically, these would in a developing fetus be the umbilical arteries, and so these are the umbilical ligaments, and this here is the umbilical artery heading out. Now coming off of that umbilical artery, it's kind of difficult to see this, but we have branches that come across the pelvis laterally called superior vesical arteries. And the uterus here is in our way, so it is obstructing our view, but we can kind of imagine those branches coming down to innervate the urinary bladder here. It's important that we consider the blood supply to the uterus as well, because what we can see also is a branch of the anterior division of the internal iliac is a uterine artery. And that uterine artery and the ureter are going to cross one another. And there is a rather popular mnemonic, water under the bridge. And in this case, the water is the ureter. So the ureter is running under the bridge, which is the uterine artery, at approximately the internal os of the cervix, which is right about there. So this is a way for OB-GYNs to remember the relative relationship between the ureter and the uterine artery while they're working in the pelvis. So in some individuals, there will be inferior vesical arteries as branches directly from that anterior division of the internal iliac artery. And in other individuals, these inferior vesical arteries may either be branches from the uterine artery or the vaginal artery. And in fact, what we probably see between males and females is homology between what would be the inferior vesical artery and the uterine and or vaginal arteries. So it's not all that unreasonable that inferior vesical arteries would be branches of uterine and vaginal arteries when present. In fact, when we look at the blood supply for the uterus and the vagina, oftentimes we'll see branches from the uterine artery to the vagina and from the vaginal artery to the uterus. So like I said, blood supply within the pelvis, it can be kind of confusing, but that's a lot of the fun. So let's get to the urinary bladder. The urinary bladder is sub or extraperitoneal. So the peritoneum runs over the top of the urinary bladder. And so that portion of the bladder would be subperitoneal, and then everything else would be extraperitoneal, so it has nothing to do with the peritoneum. When we look at the base of the bladder, so this is a view of the bladder looking from the anterior, so from the anterior to the posterior. That base of the bladder, or the posterior wall, is going to have two ureteric orifices where the ureters enter. Between the two is the ureteric crest. And then down here is the internal urethral orifice. So that's the opening to the urethra. Now if we being the pattern-hungry species that we are, connect all of those dots, we can see a triangle, and we call this the trigon. Now, the bladder is a very expansive organ, and its wall is layered with smooth muscle. And so when the wall of the bladder is contracted, we see lots of ridges of mucosa, and these ridges are called rugae. And those rugae are going to disappear when the bladder expands. That detrusor muscle is supplied by blood by both superior and inferior vesical arteries, and it is innervated by the vesical plexus, which is an autonomic plexus. Before we move on, though, I want us to appreciate that where that internal urethral orifice is, the detrusor muscle surrounding that orifice is going to form an internal urethral sphincter. Now, because the detrusor muscle is innervated by the vesical plexus, that internal urethral sphincter is going to be under autonomic control. As the urethra descends, it's going to move through a muscle membranous portion of the pelvis, and those muscles are going to form an external urethral sphincter. Now, this is skeletal muscle, so it's going to be under somatic control or somatomotor. An individual can decide when this muscle contracts and when it relaxes. An individual cannot decide when the internal urethral sphincter contracts or relaxes. Now let's take a look at that vesical plexus. Well, we can't see it directly here. Suffice it to say, all of the organs in the pelvis, so there is the urinary bladder, there is the uterus, there is the vagina, and we can even see the rectum there. All of those organs are going to have their own autonomic plexus associated with them. So there will be a vesical plexus associated with the urinary bladder. There will be a uterovaginal plexus associated with the uterus and vagina, and there will be a rectal plexus associated with the rectum. All of those plexuses, those autonomic plexuses, are subdivisions of the inferior hypogastric plexus. That inferior hypogastric plexus are all of these fibers that we can see there. Now, there's going to be both parasympathetic and sympathetic components to this plexus. The sympathetic components are going to come from the sympathetic trunk. Specifically, so here's the sacral sympathetic trunk. So here we can see the ganglia of that trunk. And specifically, so this is S1, S2, S3. From that S2 and S3 ganglion, we can see fibers leaving. Those are sacral splanchnic nerves. And that is going to be one component to the inferior hypogastric plexus. There will also be pelvic splanchnic nerves. So here is sacral nerve 1, sacral nerve 2, sacral nerve 3, going down, sacral nerve 4. Branches from S2, S3, and S4 that go into the pelvis. So keep in mind, these are ventral primary rami, so they are mixed, but they're going to transmit preganglionic parasympathetic fibers called pelvic splanchnic nerves. So pelvic splanchnic nerves are parasympathetic. Sacral splanchnic nerves are sympathetic. So that works out well. So the plexus is mixed. So that inferior hypogastric plexus is mixed. And it also has some fibers descending down from the superior hypogastric plexus, which aren't shown here via these hypogastric nerves. So there's a lot going on here. When the urinary bladder stretches, it can initiate what's known as the micturition reflex. The micturition reflex is usually triggered when the bladder is about 300 to 400 milliliters full. Specialized stretch receptors in the wall of the bladder, called baroreceptors, are triggered, and they're going to send a message back through visceral afferents. This is sorted out in the central nervous system, and then effector signals go into play. These include parasympathetic stimulation of the detrusor muscle. So the detrusor muscle is going to contract. Simultaneously, the portion of the detrusor muscle that forms that internal urethral meatus is going to relax under sympathetic stimulation. So the bladder's contracting, the internal urethral sphincter is relaxing, and the only thing that stands between urination or micturition or not is the external urethral sphincter. That external urethral sphincter is in most adults under voluntary control, and so an individual can choose to relax the external urethral sphincter, and then urination is complete. Now let's take a look at the urinary bladders and urethrae of various individuals. So the sagittal pelvis that we're seeing here from a medial view would be what would typically be considered a female pelvis. We can see the urethra, the urinary bladder, and we can see that the urinary bladder has a position that's intermediate between the pubic symphysis and the uterus. We can also see that the vagina closely follows the base of the bladder posteriorly. And so here is the internal urethral meatus, and there is the external urethral meatus, and we have a urethra of about 4 to 5 centimeters. And that external urethral meatus is going to open posteriorly to the glans clitoris and anteriorly to the opening of the vagina or the vaginal orifice. Now let's take a look at the urinary bladder and urethra of what would be typically a male pelvis. And in this case, the urinary bladder is expanded greatly. So here is our bladder. And we can see that it is sitting atop something new. So this is the prostate gland. We can see the internal urethral orifice there, and we can see that it is sitting at a point that is partially enveloped by the prostate gland. Now, the male urethra is tripartite. There's 3 portions to it, and that first portion of the urethra is called the prostatic part. So they named this very well. What we're looking at up here in this cadaveric photo is the trigon of the bladder. So there is the 3 points. Right there is the internal urethral meatus. Here are the ureteric orifices and the crest. So there's the trigon. This is anterior here. So this would be kind of a supero-anterior view. And what I want to show you here, just erase all of this, is that the internal urethral meatus is kind of U-shaped. And that's because what's typical of the male bladder at that beginning of the urethra is that there is an expansion of the mucosa, and that's called the uvula of the bladder. And that represents a growth of the middle lobe of the prostate gland, kind of invaginating the urethra. Now, as the urethra moves through the muscular floor of the pelvis, it's going through the membranous part. So that's the urogenital diaphragm that it's traversing at that point. And then it enters the penis. And the urethra within the penis is called the spongy urethra because it's contained by the corpus spongiosum, which is one of 2 types of erectile tissue in the penis, the other being the corpus cavernosum. And the external urethral meatus is located on the ventral portion of the distal glans penis. And that leads us to the assessment question for this video. The trigon of the bladder is the area bounded by the ureteric orifices and which other structure? Is it detrusor muscle? Well, no, that's throughout the bladder. External urethral meatus? Nope, that's where urine is leaving the body. External urethral sphincter? Nope, that's in the urogenital diaphragm. Internal urethral meatus? Sounds pretty good. Rugae? No, those are the ridges within the bladder. So yes, the trigon. The ureteric orifices, there's the crest, and then the internal urethral meatus is going to form that trigon. Thank you very much for your time.